Okay, start. Namaskara and a very warm good evening to all the respected dignitaries, esteemed faculty members, and dear scholars and passionate students of Ayurveda. It gives me immense pleasure to welcome you all to this intellectually enriching session of Samhita Sambhasha presented by Vishwa Ayurveda Parishad. Today's topic, scientific validation of Charaka Samhita in today's era, is both significant and timely. Students and practitioners of Ayurveda, it is essential for us to revisit our classical text through the lens of modern scientific understanding. The wisdom of Charaka Samhita has guided our generations, and validating its principles in today's context strengthens both its relevance and credibility. With that being said, I'd like to extend my heartfelt welcome to all the dignitaries that are present today. Today's guest speaker, Dr. Samir Manohar Joshi, sir, convener, Dr. Anand Katti, co-convener, Dr. Mohan Joshi, coordinator, Dr. Nikita Sharma, co-coordinator, Dr. Devendra Singh Chahar, and coordinators, Dr. Rohit Ranjan, Dr. Umang Pandya, Dr. Sangeet Mishra, Dr. Venkat Shivudu, Dr. Bharat Chauragade, Dr. Arvind Kumar Gupta, Organizing Secretary, Professor Yogesh Chandra Mishra, National President, Professor Mahesh Vyas, General Secretary, Surinder Chaudhary, Rashtriya Pramukh Shikshak and Sambhash Prakosht, Professor Anil Shukla, and I also extend my warm welcome to all the participants of today's program. Now, I request Kirtana to start this event with a prayer.
नमामि धन्वन्तरिम् आदिदेवम् सुरासुरैर्वन्दितपादपद्मम् लोके चरारुक्मय मृत्युनाशम् धातारमेशम् विविधौषधीनाम् धन्वन्तरिं रमानाथम् सर्वरोगनिवारकम् आयुर्वेदप्रवक्तारम् वन्दे पीयूषदायकम् ॐ शान्ति शान्ति शान्ति.
Thank you, Kirtana. That was delightful. Now, I would like to request Dr. Anand Katti, sir, to speak a few words as opening remark. Over to you, sir.
Thank you, Sindhura. Sabhaya Namaha. Very good evening to all of you. Dear members, delegates, as you are aware, every 21st of every month, we conduct one session on Samhita Sambhasha on the platform of Vishwa Ayurveda Parishad Shikshaka Prakoshtha. And today we have a session by Dr. Samir Joshi, sir, who happens to be teaching faculty at Gomantak Ayurveda College in Goa, Shiroda. Today's session is validation of the Charaka Samhita in present era. Sounds very interesting topic. And sir carries a vast clinical experience who will bring about the intricate shlokas of Charaka Samhita in the clinical practice, how they made sense to him, and thereby these participants will be greatly benefiting by this session, that I can assure. As far as the topic is concerned, one know the fact that in present era, when we talk about Charaka's principle, do they stand valid? The question comes, but the answer is obviously yes, a thumping yes, because right from the beginning, we learned the fact that this Ayurveda is a Shashvata. One of the reasons that we gave for eternity of Ayurveda is Soyam Ayurveda Shashvato Nirdishyate Anaditvat Swabhava Samsiddha Lakshanatvat. This Ayurveda is based on the fundamental principles of the nature. It is the natural principles that are prevailing which has crafted the science called as Ayurveda, and therefore the nature will be existing, so is the Ayurveda. And this gets connected to another important, significant swarupa of Ayurveda that we call as Tattva Shastra Prayoga. We know the fact that Ayurveda is given to us in the form of Tattva, which are the fundamental principles which have been scripted in Samhitas, which become Shastra, and the Prayoga is the way we use it. Therefore, the Tattvas are Shashvata, and so is the Ayurveda Shashvata. Only difficulty or the challenge comes how to make it relevant today, where we talk about the Prayoga aspect of Charaka Samhita. Right. So the Prayoga, taking for example the shlokas like Ahara Sambhavam Vastu Rogashcha Ahara Sambhavam, everything, every disease is made up of that faulty lifestyle, faulty food habits, has given more importance than in the entire history of mankind when we talk about the diseases like the non-communicable diseases, the diseases like the cardiovascular diseases, the obesity, overweight, the dyslipidemia conditions, the diabetes mellitus, the chronic kidney diseases, and so on and so forth, the various cancers. If you connect, the seeds of all those diseases go back to only one thing: what we consume through our food is coming to us as diseases. One of the time tested eternal principle of Ayurveda, which has been drafted in Charaka Samhita and Annapana Chatushka. To bring to your light another important concept is the epidemic that we see in the form of diabetes. India is said to be the diabetes capital, and Charaka says Sadhya Kapota Dashaha Pittaja Shadyapya Na Sadhya Pavana Chatushkaha. We are right now in a position where we know the fact that Kapota Dasha Prameha are curable, they are manageable. And today we learn them as a status of pre-diabetic conditions where we see insulin resistance as a condition. Insulin resistance is reversible. Insulin inadequacy or insulin indeficiency are going to be the conditions which we learn as Madhumeha, which require lifelong management. So when he says Sadhya Kapota Dashaha, it makes sense for us today as insulin resistance condition, so which is very much reversible. And we know the fact that I mean the particularly the gamut of metabolic disorders go and so forth. One, I'll bring another important concept of Charaka Samhita, which is very valid, which is clinically seen today, and conclude my opening remarks. And that I said, Karshameva Varam Saulyat Nahi Sulasya Bheshajam. The reason that Charaka says if both the patients are suffering from the same disease, it becomes difficult to manage to treat this same disease. Even a common cold will become difficult if the person is Thaulya. So it is leading to an immunocompromised condition, and we know the fact that this Thaulya pathology, the obesity pathology, what it leads today is entire condition of immunodeficiency. So these are some of the time-tested eternal principles that are strongly appealing, and there are many such points that the speaker would be throwing light on. I know the capability of the speaker. He's a very ardent and disciplined practitioner. He practices Ayurveda to the core, and at the same time, he is into the teaching in one of the reputed colleges in Goa. We are grateful to have Dr. Samir Joshi on this platform. Again, on behalf of me, I extend a very cordial welcome, and I conclude my comments. Over to you, Sindhura.
Thank you, sir. That was a very insightful speech. Now, I'd like to welcome our chief guest. We are deeply honored to have with us today a respected scholar and academician, Dr. Samir Manohar Joshi, as our guest speaker. Sir is Associate Professor in Department of Samhita Siddhanta, Gomantak Ayurveda Mahavidyalaya and Research Center, Goa. He is also a founder and chief consultant at Arogya Niketan Ayurvedic Clinic and Panchakarma Center, Goa, chief consultant at Omeo Clinic Panaji and Kamakshi Arogya Dham. Sir has been awarded DSP Persona Nation India Award 2024 by Dream Studio Ventures, Ayu Ratna National Award by International Institute for Social and Economic Reform, Bengaluru. His work reflects strong commitment to advancing Ayurvedic knowledge through both scholarship and practice. We are privileged to have him with us today and look forward to his valuable insights. Without further ado, let us begin this scholarly journey. I now humbly invite our esteemed guest speaker, Dr. Samir Manohar Joshi, sir, to enlighten us on today's topic. Over to you, sir.
Namaste to everyone. Am I audible?
Yes,
You're
sir.
audible.
Yes, thank you very much. Good evening
Yes,
to
sir.
all respected dignitaries present at this session, respected teachers who are present, my fellow colleagues, students, the PG, UG students, PhD scholars who are present. First of all, I thank all of you for considering my name for this prestigious session. It is called as Sambhasha, Samhita Sambhasha basically. It is one of the need of an hour. The topic which is we are going to see today is a scientific validation of Charak Samhita. We'll be considering when you look at the topic, when you look at the title, sometimes some people may feel that this may be a theoretical session, this can be a session with full of shlokas right from Charak. It can be a presentation where I will be explaining about the theoretical concepts. But yes, I will be doing it in the introductory slides. But our focus will be basically on the case studies which I have seen in my clinical practice of 17 years. I will be highlighting few cases. In the presentation also, the introductory slides will be right from the introduction of Charak Samhita, the peculiarities of Charak Samhita. Then we will be discussing about the research concept which is discussed in Ayurveda. Nowadays, there is a trend of research everywhere. But when we will see the depth of Charak Samhita, the ancient, one of the ancient granthas, the base granth of Ayurveda, when we look at it, we feel that research is not now standardized, but Acharya Charak had standardized the word research itself 5,000 years back, not now. When we are considering about the scientific validation, I am not the person who can validate Charak Samhita. Charak Samhita itself is validated, so it doesn't need a specific validation. But when we are considering about our focus in today's era, what is need? And the data collection, when we are considering about research, when we are considering about international platforms, when we are considering about the practicing Ayurveda across world and understanding Ayurveda across world, what should be done is we should speak the language in which the world understands it. Being the faculties of Ayurveda, being the part and parcel of Ayurveda, the things which we are going to understand from reading our text, we will be very happy that Ayurveda has emphasized, Ayurveda has included each and every aspect of today's research aspect. But when we are considering about the modern presentation, when we are considering about the modern science, when we are considering about other parameters which we are going to see, what will be important here in our presentation is consideration of the scientific validations, considering the scientific topics, considering the concepts which are described in Ayurveda, and how we are going to understand, how we are going to correlate it with today's era. So we need to consider a data, we should consider the research, and accordingly we can prove Ayurveda. There are few opinions where we can see that people feel that our science is already proven science. It doesn't need something which can prove Ayurveda. But what I feel as a practitioner, what I feel as an academician, that we are not, it is not something which will show us on a lower scale, but it will see that our science progresses to the extent maximum which we can help, and we can extend our science across world. So we should speak the language which world understand. We should have a data which will prove our science. Although it is Anadi, Ananta, Shashwat science, we need to prove it. In the statement, Sir Anand Katti sir has said that it is a Shashwat science, and we are supposed to understand the depth of the science. And for that purpose, we are supposed to read the text which is there, and we are supposed to implement. When we consider Ayurveda, when we consider Charak Samhita is a text where you read a concept and you apply the concept. It is a science where it is a concept where you have the implementation which can be seen in your clinic, in your clinical practice, in your OPD, IPDs. When you see Charak Samhita, when you read Charak Samhita, you can directly see the presentations which are described by Charak Samhita. You can see a patient with the presentation which is described, and it is the thing which we need to understand. We need to read, we need to understand. And what I feel, sometimes the senior faculties, they consider that we should understand the meaning in between the lines. But what is my opinion as a practitioner for last 17 years or 18 years as an academician, whatever is written in Ayurveda, it is a clear-cut reference. There is nothing in between the lines. Whatever is explained, it is in those lines which we need to understand, which we need to validate, which we need to understand, and we need to implement. So here, when we will start with the presentation, the first, it will be an introductory slides of Charak Samhita, highlighting the peculiarities of Charak Samhita. Then it is about the laboratory studies, about how Charak has proven the laboratory testings. It is about the prognostic tools, whatever we will be discussing with the slides which are present. And when it will come to the implementation of science, we will have a discussion on few cases where we will be discussing about a few cases like Udavarta. I have selected some unique cases which are not regularly seen in the clinic, such as Udavarta. Now it can be, if you diagnose Udavarta, it is very good, but sometimes it goes unnoticed. Okay, and I will be sharing few references from Charak also, where Udavarta and how it is related. We will be seeing a case of Hikka. So I have read more than 25 cases of Hikka. It is an emergency case presentation. Okay, so we will be discussing with such area. When then Visarga, then I will be showing a case of Palitya also, where it is a case of basically Indralupta, but we will be considering it as a Palitya, which is given by Acharya Charak. Khalitya Palitya, which is both, which are presented, and accordingly we will proceed. So I will request sir. Our sir has already changed the slide. Okay, thank you, sir. So the first slide here, when we are considering about the introduction of Charak Samhita, the evolution of Charak Samhita, it is already everybody are here aware about the evolution of Charak Samhita. So I will not go in detail, but it is one of the Bruhatri. It emphasizes on holistic approach, and it is the basically focuses on diagnosis, prognosis, and treatment. Okay, so we will be considering all those parameters, the different siddhantas which are explained in Ayurveda. For example, Dosha, Siddhanta, Samanya Vishesh, Siddhanta, the concept of dhatus, malas, whatever we say, it is everything is present in Charak Samhita. But one thing which we need to understand at every parameter, that the modern science also acknowledges the principles which are given, which are written in Charak Samhita. Next slide, sir, please. So when we are considering about different presenting features of Charak Samhita, everybody knows about the total sthanas of Charak Samhita, different 8 sthanas, total chapters, total sutras, total formulations. We will be focusing on the formulations which are not, sometimes when I say in clinic also, when the students they visit the clinic, sometimes it is very difficult to use the kalpas which are directly given in Charak Samhita. They are not as readily available as the other dravyas which are available. So sometimes it can be a difficulty. So we'll be discussing, but around 2000 kalpas are explained and discussed in Charak Samhita. Next slide, sir, please. So when we are considering about the specifications of Charak Samhita, peculiarities of Charak Samhita, it is about the different chatushkas which are described and which are explained in the Sutra Sthan. The importance, I will be not discussing about the peculiarities of Charak. I am here to do the scientific validation. So when we are considering about the different chatushkas, each chatushka has specification given by Acharya Charakas. So when we are considering the 30 chapters of Sutra Sthan, when we are considering the interlinking of the chapters, it highlights how advanced Charak was. So it is not about just writing, go on writing chapters, or just, it is not just giving the description and just not considering the different sthanas, but it is the specification which Acharya Charak has given in Charak Samhita, not only in Sutra Sthan, but when we are considering about other sthanas also, when it comes to Indriya Sthan, it is one of the peculiarity of Charak Samhita. When it comes to Viman Sthan, which Acharya is giving us. Okay, so all these are the beauties of Ayurveda which are mentioned by Charak himself. So also when we are considering about Viruddhahar, when we are considering, as Sir Katti sir has already mentioned about the Janapadadhos, okay, so when we are considering about the epidemic disorders, sorry, it is not about water or air or soil, but nowadays when we are considering your epidemic present in Janapadodhos, the recently which the diseases which suffered, now we need to sometimes restructure the presentation, and we should rename it, how the Janapadodhos can be not limited with all these parameters, but what else can be also included in Janapadodhos concept. Then again, Srotas also, Ashtahar Vidhi Visheshatan also are the points which are included by Acharya Charak. As a, you can see the depth, not only in Sutrasthan, but in Sharir Sthan, in Viman Sthan, Indriya Sthan, where Acharya is highlighting about the specificities. When, if I want to validate it here, when you are considering Indriya Sthan, it is the most ignored part of Charak Samhita, as I feel, as an academician. When I consider last 15 years I am in teaching, but when I consider Indriya Sthan, it is the most neglected kind of sthan of Charak Samhita. The weightage given by also the authorities is comparatively less when we are considering about Indriya Sthan. But when it comes to the clinical practice, when you see the presentations, when you are considering the prognosis of Acharya Charak, when the prognosis of any disease which is described by Acharya Charak, you will not deny the fact that the Indriya Sthan is the presentation of the patients which are admitted in CCUs and ICUs. A few people, they have and very good intents at the end of their DMS or at the end of their internship or during internship, the people try to work in ICUs and CCUs. I appreciate that, because when you start, but along with that, when you try to validate, when you try to correlate it with the Indriya Sthan concepts, you can see the arishtas which are the Mrityu Suchak Lakshanas. And when I was studying in Pune, I was very lucky to work with Dr. Ashutosh Patankar sir. So when I used to visit sir in different hospitals to see the complicated cases which were admitted to ICUs and CCUs, sir used to always say the prognosis, why and how, and he used to give the references directly from the Indriya Sthan. So these are the present, and the lifespan of this particular person is expected to be 1 week, 2 weeks, 3 weeks. In my practice also for last 17 years, I have also been that kind of in situations where I was supposed to tell the prognosis of the patient, and with the God's grace and with the knowledge, the alpa knowledge, which I can say, I always say that we are alpa buddhi, and Charak has described the parameters for alpa buddhi, the people like us. Okay, so based on the knowledge of Indriya Sthan, the prognosis which was made by me, it was correct. So when we are considering about the scientific validation of Charak Samhita, the Indriya Sthan concept, the people who I will request people to see at least as an observer for a few days, to be in ICUs and CCUs and see the impact which is given in Indriya Sthan. It will 100% match with the patients which are admitted in CCUs and ICUs. Then again, coming back to Viman Sthan, Indriya Sthan, we have already discussed. Next slide, sir, please. So next slide, sir. So these are the references from Charak Sutra Sthan chapter number 1, where we can see that I will not go in detail about discussing the shlokas. So I will be telling you the end part of this. So when we are considering about the medicines, when Ithancha Nana Aushadhi Bhutam, when we are considering about using a dravya, I always say the most easiest part when we are considering a patient, when we are considering about a clinical practice, the most easiest part is the treatment part. And the most difficult part which we face on daily basis is the diagnosis of the disease. But when we are considering about the easiest part, treatment, but when we are considering about the different dravyas, either it can be the vanaspati dravyas or the bhasma kalpanas or rasa aushadhis, what we call them. Okay, when we consider such kind of dravyas, it is the responsibility of the physician to understand those dravyas properly. We should understand the dravyas according to desh, according to kal, according to prakruti, according to their habitat, and accordingly we should understand the rasaguna virya vibhag prabhav of that particular dravya. If we are not aware about a particular dravya in detail, and if we are just blindly go on using the dravya, so here slide, it can be acting like a double-edged sword, where a misuse or the physicians who are not aware about any dravya, and if they are blindly using the dravya, my senior was using, my teacher was using, and for that purpose, if I am using any dravya, it can be dangerous. It can be act like a poison. It can be act like a weapon, and it can have a adverse effect on the health of the patient. So we need to be very careful. And when we know about any dravya, it can be like a amrut, nothing better than it can be a healing, it can be a life-giving, and it can be a something miraculous, which patient may feel that your dravyas, they have acted miraculously. So coming back again, so next slide, please. So again, this shlok which is given, it is from Charak Samhita 4. It is in relation with previous slide, please. So this shlok is from Charak Samhita 4th Adhyay. If you read, it is in relation with Mahakashayas. Next slide, sir, please. So it is from Mahakashayas, where we are considering that the Mahakashayas which are given, they are given for Alpa Buddhi people. So we all are Alpa Buddhi people. So Acharya Charak was aware that he has Charak Samhita. Basically, if you start reading, the respected dignitaries also will agree. The scholars who are today who have joined the meeting today, they will also not deny the Charak Samhita itself is like a ready reckoner. We just need to open Charak Samhita. We need to just read it, and we just start applying it in our patients. That kind of situation. So the previous shlok which was given in the Charak Sutrastan 4, it is in relation with Mahakashaya Adhyaya. But the shloka can be applied not only in relation with Mahakashayas, but it can be implemented and it can be applied in all the parameters, all the scenarios which are which we can see in our clinics on day-to-day basis. So it is applicable for not only in terms of Mahakashayas, but any Aushadhi which you consider, it can be a key for you for your successful practice. So coming again here in terms of research. So here in this chart, it is a data, information, knowledge, and wisdom, the 4 highlighting word. So the data which we have, it should be what is research basically. And this is the modern definition of research, and we will be understanding about praman, which is, and I will not go in detail. So you are supposed to just relax, because this is the first year syllabus which we have already learned. Okay, so when we are considering about data and we are transforming data, it's a transformation of data into information, and information into knowledge, and knowledge into wisdom. So when we are considering about this parameter, so next slide, sir, please. So when we are considering about Ayurveda, when we are considering about the parameters which are there, the correct knowledge, the valid and correct knowledge which is described in Ayurveda is considered as a praman, and the tool and the measure to acquire this knowledge is praman. There are 4 types of praman. I will not go in detail about Aptopadesh, Pratyaksha. So next slide, please. So here in this slide, we have studied about Aptopadesh, Pratyaksha, Anuman, and these are the parameters. When we see this, when sometimes we try to read it, sometimes it looks very simple, very easy, but when it starts the implementation of this without these 4 parameters, the ancient scientific methods which we are learning, research and implementation of Ayurveda cannot be done without understanding these 4 parameters, these tools which are there. So when we are considering about Aptopadesh, the definitive concept of Aptopadesh is the authoritative testimony. Here I have written it. But when we are considering about Apta, yeah, the Apta can be anybody. In my clinical practice, I consider sometimes the things which the patient tell me, sometimes he can be my Apta. Okay, so it is a subjective criteria when we are considering about these four parameters. Then everybody knows about Pratyaksha, Anuman, and Yukti. The most important factor here in the clinical validation when we are considering the implementation of the concepts which are given in Ayurveda, the main thing which will help us is the inference when we are considering about the conceptual and the intellectual part of Charak. The helpful tools mostly here are Anuman and Yukti is the most important thing which we need to use on every day and every point basis. If we are not considering Yukti, it will be very difficult for us in today's practice or anytime practice. Okay, so every concept mentioned in Charak Samhita basically has a scientific base. Without scientific base, Acharya Charak is not explaining anything without proper scientific base. So we need to consider when we are, and it is supported by pramanas, different types of pramanas which we have already seen. They are the supporting system of the different scientific concepts which are based and proved by Acharya Charak in scientific manner. So here when we are considering about the clinical validation or scientific validation of Charak Samhita, when we are considering about animal studies nowadays, but Acharya Charak 5,000 years back has proved that he has also done animal studies, not only in terms of finding out as a part of a diagnostic tool, but in cases of diagnosis also, he has seen and used animal presentation, animal studies in cases of the presentation. So here when we are considering about different types of presentation, the animal models for toxicity, Vishavek, when it is already proved that I will be not going in Charak Chikitsa 23 chapter where or Charak Sutra Sam 7 chapter 9 chapter, wherever the references are given, when the food is poisoned, the flies die leading to the poisonous eating poisonous food. The voice of crow becomes feeble, then the chakor becomes this, I become this. So we need to understand. I don't feel that chakor is seen by everyone, but the parameters which I am going to highlight here are the different parameters which are given. Fly sitting on food will die. Okay, the crow will make feeble sound. So it is technically when we are considering, it is very difficult to see a feeble sounded crow nowadays. Yes, but now when we are considering about the assessment, when we are considering about the validation, we have a data, we have a proof that Acharya Charak also used the animal studies for research purpose and prove and validate our science. It is not just a blind concepts which Acharya Charak has gone writing and writing different sthanas, but he has proved it on the basis of animal studies. And when we are considering about the Prameya, as Katti sir has already mentioned that when we are considering about the clinical presentations of Prameya, nowadays I will share few my experiences if time permit. That when we are considering about Prameya, it is in modern science when we are considering, the people are making it hype that India is becoming the capital of Prameya and whatever. So whenever we are considering about the studies regarding with Prameya, it is not only the Prameya which is highlighted as a lifestyle disorder and the lifestyle factors are responsible, but you have to believe that 5,000 years back also Acharya was aware about Asya Sukham Swapna Samah. He was aware about Asya Sukham Swapna Sukham. He was aware about the lifestyle which the people were following that time, or the probability that he might have seen that in coming era the people will follow the lifestyle or lavish lifestyle which will lead to the increase in Prameya. So he has explained not only 1, 2 or 3 types, insipidus, mellitus or any other presentations of diabetes, 2, 3, 4 presentations, but Acharya Charak went on describing 20 types of Prameyas. So the depth of science, when we are considering the validation of Charak Samhita, it is already proved, and when we are considering the laboratory testing and the standardization protocols in this slide also, there are few references maybe here where which may not be from Charak Samhita, but I have made them as a part of presentation to make it attractive and to consider and to highlight the laboratory testing and standardization protocols. Okay, so some may have query that these are not told in Charak Samhita or something like that. But as a part of presentation, I am just showing this. When we are considering about in Indriya Sthan also, when acharyas are considering about Purish Pariksha or what I can say, sputum examination or semen examination. In Indriya Sthan also, Acharya Charak in 9th chapter here describe about different types of different colored semen, different colored stools and sputum which sinks in water. They are considered to be the Lakshana. So this is again a lab test which was proved by Acharya Charak and it was validated, and we can see nowadays also the presentations which are there in CCUs and ICUs, where you can see about the presentation which are mentioned in Charak Samhita as a lab test which are done. You can see them in day-to-day practice also. Then when we are considering about standardization of these protocols, Acharya Charak was having standard SOPs for everything. So when we are considering about standard operating procedures, it has explained in terms of drugs, it is explained in terms of patients, dose of drug, whatever you say, the standardization has been mentioned. It is not just a vague statement from Acharya Charak where we are just considering it and we are just, as it is written in Charak, we are just applying. Acharya Charak has specified, Acharya Charak has made a standardized protocol for everything. I have given few examples here. I have given the example of Snehan, I have given the example of Snehapan and Basti. There are n number of examples which I can quote where the standardization of our procedures, when the standardization of drugs, standardization of selection of patient also is a standardization basically. Which patient has to be accepted, which patient has to be, when we are considering about sadhya of the disease, it is again a standardization. We cannot just consider that it is just given as a sadhya the prognosis of the disease. No, it is a standardization protocol, it is a standardization tool which is making our practice easier. So if acharyas are not giving us the types, acharyas are not giving us the prognosis, the differentiation, the standardization, then it is very difficult for us to consider those kind of patients and to treat them at a clinical level. So as I always say, Charak Samhita is a ready reckoner. So ready reckoner, it is a basically standardized protocol which are given. We just need to follow those. But we should understand these are the standardization protocols and these are the things which we need to follow. If we are not capable of understanding the textual concepts which are given, it will be very difficult for us to do the implementation of those parameters in our clinical practice. Again, this is the reference of the previous. Next slide, sir, please. So when we are considering again the standardization, when we are considering about different types of jwaras, again you can see the pathology of the disease. Again, when we are considering about jwar, you might have seen in your practice also, the students might have seen in the case paper also. Sometimes when the patients are admitted, jwar is one of the vyadhi where Acharya Charak himself says the one who can treat jwar can treat any disease from this world. So when we are considering about the pathology, when we are considering the pathologies of the jwar, it is very important. It is what I feel in the practice when we see it. When a patient visits your clinic with the presentation of jwar, it is the first duty of us is to understand the pathogenesis of that particular patient, how the jwar has occurred. Because the number of jwaras which are explained, we cannot have of pathogenesis where the modern science people, they just write pathogenesis of unknown origin. As we have a Karyakaran Bhav Siddhanta, then cause and effect theory, we cannot have effect without the presence of cause. So when we are considering any type of jwar, so if you want to genuinely practice, you need to understand. And nowadays when we are considering the validation of Charak Samhita, sometimes you may feel that I have used different kalpas from Charak Samhita, but yet I have not got the output which was expected. Sometimes it may happen, it is not because of the deficits of Charak, but it is because of the deficits of a physicians like us. So whenever I say nowadays, because of this Rutu Viparya, this always you need to remember when we are considering about different Rutucharyas, different Dinacharyas. One thing we need to believe is that the practical implementation of the Rutucharyas is technically getting difficult in today's era. So when we are considering about the Charak Samhita, Acharya is Charak was very much advanced. He has never said that you follow only this. He has given you the option that you should go and opt for Yukti and you should decide the things which will benefit your patient. So when we are considering about Rutucharya, when we are considering about Dinacharya, it is not just only the consideration of Rutu, but now if you see whenever you stay, you can see the pattern of Rutus have changed. And we need to correlate it, we need to understand it, we need to modify the Rutucharya as per today's requirement. Acharya never said that you don't change this. Acharya is free and Acharya always said that you are supposed to do the things which will benefit your patients. So here in this slide also, when we are considering different types of jwar, when we are considering Antidushka jwar, it is because of the affliction of Rakta Dhatu and occurs every day. So here I have given Tritiya, Chaturthak. Again, this is the precision which is given. Again, this is the scientific validation where Acharya was aware about the parameters. He has just not named the diseases, but he has given the specification. He has given the critical prognosis for the disease like jwar. So we need to consider, it is our responsibility that when Acharya Charak is describing something, to extract the meaning from those lines is our responsibility. As I told in the first moment that I am not the person who can validate Charak Samhita. Charak Samhita is already validated. But it is our responsibility to make it understand to the layman, to the public, so that we can spread Ayurveda across globe. We need to understand it, we need to consider the facts, and accordingly we should start proceeding and implementation of Charak Samhita. As I told, it is a ready reckoner. We need to understand it, we need to understand diagnosis. Diagnosis will play a critical role in every scenario. Next slide, sir, please. So when we are considering about physicians handbook, Charak, as already we have discussed this. So it is not every time when we are considering about disease. In today's era, when we are considering disease presentation, people, they are the patients who will be visiting your clinic, your OPDs, IPDs. The patients are advanced. They just Google the presentations, they just Google the signs and symptoms. They will have a differential diagnosis, and they will get that DD to you and say, doctor, whether I will have this or this or this. Sometimes there is a situation you may face. Rarely I have also faced that sometimes the diseases which are mentioned by the patients, we are also unaware about that kind of syndrome or some kind of presentation which are mentioned by the patients. So a physician need not be ashamed if he cannot name a disease, as long as understands those imbalances. So from this slide onwards, we will be understanding different types of clinical presentation. The best person who is considered to be good in practice, who tries to understand the theoretical part and the implementation of their theoretical part in the clinical practice. Okay, so this we have as a ready reckoner for clinical success. Next slide, please. Next slide, sir, please. So it is a case study when we are considering about the presentation. So one thing I want to make it clear, there may be a query after the presentation that the things which are mentioned, described in the cases. So I want to put a disclaimer before that when we are considering about these case presentations, sometimes in some cases I might have used the kalpas which are given in Charak Samhita. Sometimes I might have used the treatment protocol which is described by Charak. Sometimes I might have used the signs and symptoms to diagnose the particular presentation as per Charak. So the treatment which is given for these patients will not have only the yogas and kalpas which are explained only in Charak Samhita. So when I started practicing, it is the base that Charak Samhita, which I love Charak Samhita. My thesis was also based on the Charak Samhita. So I follow Charak Samhita from bottom of my heart. But when it comes to practice, sometimes you need to follow the sorry protocols given in Charak Samhita, but the medication which may be present may have different associations which are not explained in Charak Samhita. There may be some kalpas which may be from Beshaj Kalpana, any text, from any text, Prasaratna Samuchaya or Sahasra Yoga, it can be anything. But I want to clear it. The diagnosis and the understanding of these cases was based on evidences given in Charak Samhita. So as we progress in this case scenario, I will be telling you that the first case here is about Hikka. Till date, in 17 years, I have treated only 22 cases of Hikka. To be very frank, Hikka as an emergency condition, I have treated only 22 cases as a Vyadhi. Acharya Charak has devoted a full chapter on Hikka. Hikka Chikitsa is a full chapter devoted by Acharya Charak. But in my practice, I have gone across and I have treated only 22 cases till date of Hikka. This one case I would like to discuss here is about a patient, male patient who is 27 years of 27 years of age. He was slightly overweight, 99 kgs. And as I practice in Goa, we have Anupdesh. Okay, so the complaints, present complaints. If you see the presentation of the case, you may find n number of technical lacunae in this case presentation. Right from duration and the mentioning, I have not given and mentioned all the detailing. It is written on my case paper, but I have not mentioned all the parameters in this case presentation as a PPT. I have not included everything. I have just highlighted the important points and just so I'm putting again a disclaimer that there may be a sir has not given and highlighted the duration and time and the occurrence of the disease. But I have tried to make it easier because we have only 1 hour and we need to conclude in 1 hour. So when the patient visited, it was a continuous Hikka for last 3 days. And when I started asking the history of the patient, the first presentation, when I checked the Nadi, I want to make one thing very clear that if you want to be a successful practitioner, you need to, this is for the students, UG, PG students and the PhD students, not for the practitioners, pardon me. So you need to attend and see the maximum number of patients. You need to communicate with the patient. Now NCSM is focusing also on the communication skills. So again, I always tell to my students when I go to class, in a week's time, at least three times I tell this line, that case taking is a skill. It is an art and everyone has to develop that art. If you are not capable of communicating with the patients, it will be a difficult situation for you in coming days. So, and when we are considering about the assessment, I was lucky that I studied with, means I was a student of Ashutosh Patankar sir in Pune, and sir is known to be a Nadi practitioner. Okay, so I don't claim, I have never claimed that I am a Nadi practitioner or Nadi Visheshanya, but I sometimes it is God's gift to me that sometimes with my assessment, Nadi Pariksha, I can find out something. So when I checked the Nadi, the first question was asked to the patient that whether it started with Jwar or not. And the patient started, yes, it started with Jwar 4 days back. I had a Jwar. Then my second question was whether it was followed by vomiting or not. The patient said yes, and I have written a history of Chardi 4 days back. So the patient, when we are considering about the presentation, the patient, as we are staying in, as I stay in Anupradesh, it is one of the causative factors for Amla Pitta. Okay, so when we are considering here, the most of the patients will have this Amlodgar, Uddaha and Udvag Amla Pitta presentations will be seen on common basis. So when we are considering about this case, it is Ruddha was there, Adman was there, Chudha was Atyalpa and Nidra was not, because if the patient was admitted. I would like to highlight, I have not written this point. For this hikka purpose, the patient was admitted for 2 days in the hospital, modern hospital, and some IV were given, some kind of medicines were given, and I will not discuss all those modern line of treatments. Or highlighting parameter is the treatment which I have given. So when I asked the patient about this, the patient took a discharge against medical advice, and he visited the clinic. So the patient, when I say 27 years male, he and overweight, the Haraj hetus which I can see, you can see here are fried fish on regular basis in Goa where we stay. The fried fish and fish items are most commonly seen. Then the burger, poi, then Vikrut Jalpan, Bhojan. Here there is trend that patient in Goa, the patient, in most of the patient you will see this Vikrut Jalpan, that either it can be before food, after food, or 2 hours after food. So it is not as per the Granthokta parameters which are advised by our acharyas. Okay, so the patient used to work for late nights, and it is Akal Bhojan, then Ratro Jagan where the highlighting parameters. When I started with the treatment, the first line of treatment which I practice is this Sharkara Lavana. Nasya of Sharkara Lavana. You are supposed to make what I can say, a saturated solution of Sharkara and Lavan, Sandhav Lavan basically, and you are just supposed to put this Nasya in the, you should administer this as a Nasya. You will not believe, as I told patient, that within the administration, within 3 minutes, you will stop this wave of hikka. And the hikka structure, if you see, so next slide, please. If I can see, I have put the reference. So this is the reference from Charak Chikitsa 17. Okay, so there is one more line which I have not written, where the Hingu Hivadi something is given. Okay. So next, some previous slide, please. So Hingvashak Churna was given at the Saman Kal, when we are considering different types of Vata dosh described by Acharya. The Saman point is very important. And there was again laxative was given, Haritaki was given, Gomutra Haritaki was given. So we will not discuss it in detail, but I am telling you a key factor where Nasya was given, Sa Sharkara Lavana Nasya was given. Within 3 minutes, I got the call from the patient that it has stopped. But I has warned patient that after 10 minutes, you will again get a hikka wake. And as told, on the 15th minute, the patient got again the wake of hikka. Again, the same procedure was done. Nasya was done of Sharkara and Lavana. Then patient's presentation was subsided for 6 hours. After 6 hours, again, there was a hikka wake. Again, same procedure was repeated. Along with that, Hingvashak Churna was given Rechan. For practice, I will tell you, for the students, for every disease, every treatment, when you will see a Anuloman Dravya. It is a part and parcel of my practice. Without Anuloman Dravya, my treatment doesn't complete. So here also, I think Gomutra Hitaki was, or Gandharvartiki was given as a part of laxative Dravya. And after 6 hours, again the patient got the attack, and he has repeated the same Nasya. And from that time till date, the patient have now almost, it is 8 months back now, the patient has never got the hikka. Okay, so it is again emergency condition. So you need to understand. So if you see this Sharkaram Tamlagi Draksham books was the reference which was there, you are supposed to read the presentation of this shloka. You should understand. So you may see here Sharkaram Tamlagim Draksham. So here how you have used. Again, it is a Yukti Praman which you need to follow, you need to understand. As I told, a disclaimer was put in the first part only, that all the concepts, all the yogas will be not from Charak Samhita, but it will be as per the protocols which are given by Charak. So next slide, please. So again, a very important Udavata, when we are considering, it is not commonly diagnosed parameter. It is not diagnosed as a regular treatment, as a regular disease or diagnosis in clinical practice. So In my practice, I have diagnosed around 36 cases of Udavarta. Means I have diagnosed, I have named that particular situation as a Udavarta case. So this is the recent case of Udavarta, which I diagnosed as a Udavarta. The presentations were same which are given in the Udavarta slide. If you see, we will discuss about the shlok in the coming slides. Okay, if it is there. So, sir, previous slide, please. We will highlight this in the later class, slide. So when we are considering about the patient's parameter, this is again a male patient, 62 years, 92 years of 92 kgs weight, and he was having Tivra Udar Shul. Specifically, it was on Dakshinta, but it was sometimes it was intermittent, sometimes it was on the left side, sometimes in the central part, epigastric part, sometimes on right side. But the patient was unable to highlight exactly where the pain is. But as the patient Swanubhav, he said the main presentation was on the right hand side. Sometimes it used to shift on the left hand side, but I have written it Dakshinataha since 1 to 2 months. And the patient was having continuous Udgar. Okay, there was Adhan, severe Adman, there was Udar Gaurav, Shiro Gaurav was there, the mal was not good, the patient was breathless. Okay, the patient was taking continuous medicines for 1.5 months from modern practitioners and homeopathic practitioners, but he was not relieved with 10% also with the presentation. If you see the Ahara Jetu and the Vihara Jetu, again the Akal Bhojan was there, Attalpe Vayam was there, Guru Vidaya Anna Seva was there, and Vatakar Ahar. Here in Goa, people tend to eat different types of bakery items, mostly bread in different forms is one of the common ahar which people consume in Goa. So when I diagnosed this, in the first instance, when I analyzed the patient, I told him if you go to do the ECG, your ECG will be abnormal. So patient said, why I have heart issues or something like that. So if then I said, if my diagnosis is perfect, 101% when you will visit the cardiologist, he will say your ECG is not normal and you need to undergo n number of tests like stress tests, then 2D echo and whatever parameters which. And I told patient that if you trust me, you just wait for 15 days and we will repeat the ECG. Now you will say why I told the patient diagnosed as Udavarta patient and I am forcing my patient to undergo the ECG. If you see the treatment here, the sequence is not correct. The Kapila Aragvat was given in the initial phase. Kapila is nothing but is a Kampila Aragvat combination. You get tablets, tablet form of this. You can get K pills, Kapila Aragvat pills from different brands. Okay. And Hingwadi, Viruttar Hingwadi was given here, not given because it was advised by Charak, but I had used Hingwashak Churna. And next slide, sir, please. So when we are considering about his presentation, if you see the Roga, then if you see the presentations because of Udavarta, you can see some relation with Hruday. Okay, Rud Grahani Pradoshaha. So because of this, I will say the next slide, sir, please. So this is not that clear, but in the first slide, when we are considering about, definitely there was abnormal, the ECG was abnormal. Then the patient was very happy to see. First time I have seen the patient was very happy to see an abnormal ECG. When I told him it was expected that as Acharya, it is again a clinical validation. When we are considering, when Acharya Charak is saying in cases of Udavarta, you may see a presentation where you can have a Hruday-related diseases presentation. And one more thing here I want to highlight, when we are considering about Dharaniya or Dharaniya Vegas, we need to understand that in most of the Dharaniya Vegas, we can see some or other Gada related with heart. Okay, so when we are considering about Udavarta, it is a Pratilom kind of presentation of Vayu, and it is definitely given by Acharya Charak. So it was definite that we would have seen the abnormal ECG, and after that 15 days treatment, the pain was subsided around 70% in 15 days duration. It was not subsided completely in 15 days. And the ECG was repeated again after 15 days, and it was a proper normal ECG was seen in the 15 days duration. Then again, the Basti Kalpana was, the Matra Basti was given, as patient was not willing to take the Basti of near Kadha, that is the Path Basti, Niruva Basti. Oh, he was advised to take only Matra Basti for a week's time. And it took around 2.5 months to the complete recovery of the patient. And I have not highlighted here, the patient was known case of diabetes and hypertension, and he had a long history and repeated history of cellulitis on both legs. So I missed those points. So next slide, sir, please. I would like to ask Katti sir whether I can continue it for 10 more minutes or...
Yes, sir, you can continue.
Yes, sir. Thank you, sir. Okay, so we have 4-5 more cases. I will not go in detail about in every case. We'll try to finish it and wind up in coming 10 minutes. Okay, so when we are considering again a 55 years lady, 68 kg weight, Anupdesh, again Ubhay Hastapat Netrashi, Utset Thai, and there was Kandu, there was Daha, Arakta Varnata, Amludgar, Ajin. Again, these presentations are common. So, sir, can I see the pictures? Next slide. So this is before treatment, and I will show you a presentation after the treatment. So this was in 10 days time. The changes which you are going to see here are in 10 days. Yes, sir, previous slides, please. The first slide. Okay. So when we are considering about intervention, so Trifala Nishotter was given as a part of, so here in Kushta, when we are considering about Kushta, sometimes it is like Jwar. When we are considering Kushta, it looks very simple. But the involvement of doshas are to be assessed on the first day of the visit of the patient. You cannot have a chance. You cannot take a probability and you can just go on treating. I will try, I will see whether it has to be given or not. You need to, in every case, when we are considering about the clinical presentation of any case, not only in relation with Kushta or Udavat or Jwar or Hika, we should be very firm about assessing the Agni of the patient and assessing the cost of the patient. Deepan Pachan kind of treatment should be the first and primary treatment when we are considering about the treatment protocols which are described. And as I told you, my clinical practice, my treatment doesn't complete without giving any sort of ration. I need to add one ration. It can be anything in form of tablet. Now people are more interested in taking tablets instead of powders. So you can have, this is again time tested, and it is a requirement of today's era that we should have tableting form. There are few patients who are willing to take powders, but we need to make our medicines palatable. So again, I would like to highlight here, making our medicines palatable doesn't mean that when Acharya says it has to be used as a quath and we are making it has to be used as a kashai and we are making it as a kashai tablets. This is not the scenario which I am going to consider or accept. But it should be palatable for the patient, means we should make it as much as possible for patients to take it in a convenient basis. So here, when we are considering about the interventions, we will be seeing around 3-4 cases of Kushta. The Siddhartha Snan, again the concept of Charak and Trifala Nishotta, then Panchatikta Gruta or Mahatikta. You can have a assessment and you can decide whether the Panchatikta or Mahatikta can be given for the treatment, and results are in front of you. And along with this, Arogya Vatini was given to the patient. Okay, so next slide, please. Again, Visarka, very important when we are considering about Visarka. You will see the photographs in the coming slide. Okay, so this was the presentation when I will be discussing this case. When you look at the case presentation, you will not feel that this was the presentation. It started with the corner point and then it went on the left hand side, the last section. It went like that. So it was, sir, main slide, case slide, sir. Okay, so this was a female patient, 54 kgs of weight, and again, Dakshin Path Prashi, there was just a pitika, and there were through 3-4 pitikas which were surrounding that pitika, and she was having a jwar and there was angamarda, and this case was basically at the time of COVID, and the patient did not visit me at the first instance, but because of that pitika there was pain and shoth and daha was there. The patient visited the modern dermatologist, and they didn't diagnose it as a herpes or the visarpa, and they had given some ointment and some antibiotics, and you will not believe that in 3 days the 4 photographs which you can see a collage, the presentation was washed in those 4 days. So after 4 days, when the patient had this kind of presentation, the patient visited me, and on the first instance, my diagnosis, when I took the history, my diagnosis was the visarpa. So few ahara hetus are written. There were a number of hetus, positive factors, and then Dhawan was given with Tifra Muska Sarivakwat. If you remember the Mahakashayas, if you remember the second, third, fourth adhyaya of Charak, you will find out the best dravyas. Then again, Panchadikta Gupta was given. Sukshma Trifala Gandhagrasana is not the part of Charak protocol treatment, but this was given. Trifala was given. A region of Aragvad Vishottar was given at the time, and you will see the difference. Here I have given the references of Charak Chikitsa 21st chapter 46, 47. And 37 shloka. So next slide, please. After you can see, and after this you can see the healing of this wound, and it was healed, but it took 3 months and 10 days for complete healing, and there was no recurrence again. Next slide, sir, please. Again, this is a case of Kushta. Again, a female of 14 years, 66 kgs weight. Then Udara Mukha Ubhay Hasta Janga Pradeshi Twak Vaivarnya Tha. Then that time it was Utse Tivra Kandu Roksha was there, and she was diagnosed as atopic dermatitis by modern practitioners, and she has been taking the allopathic treatment and homeopathic treatment for past 6 years. When I took the history, the girl was very fond of all the spicy vidahi ahar, junk food, and the parents were also eager to give her milk at night, and it was also mahisha dugdha at night. Okay, so it is again, when we are taking a case, we should be very, very alert, and we should be very keen to understand about the positive factors which are there in our cases. So we cannot have a excuse. So we should ask the questions in such a way that we call it as a closed questions. So patient should answer them correctly. So the intervention was Deepan Pachan. Again, the Panchadikta Ghuta was given, and then the patient was posted for after Snehapan. The patient, as there was a one query was asked in clinic also. One of my students asked, the 14 years, how she can be advised Virechan. But it is advised because the weight was there, the bala was there, Vyadhi bala was there, the patient's bala was good. That's why although the girl was 14 years, she was posted for Virechan, and you will see the results. I have given only few photographs, but if you have seen I have not posted all the photographs. It was the results were miraculous in weeks time, but still the patient is continuing with the treatment. Now, and it is now around around 6, 10, 3, 9 months now. It is a Punarva Chikitsa which is going on. Now the skin is almost clean, but there are few patches left on the elbows and the knees. Okay, so that is the only part which this one mark sheet was given, and the other protocols were followed in the treatment. Next slide, sir, please. So Khalite Indralukta, here again, when we are considering about the reference of Charak, okay, the irregular menstrual cycle was the history as the age was 50 years. She is close to menopausal presentation, and there was Tivra Udarshul with irregular menses, and the pleasant complaint was again, as the patient is from this, the Ruddha was the common Mukhadushika Amrudgar Varamvar Shirashul and Shira Pradeshi. The Indralukta here I have written because the patchy what you can say, the typical presentation is like Indralukta, but the Khalite which is given by Acharya Charak, we will compare it with it, and the protocol which I followed for the treatment was that excessive consumption of bread and salads. Nowadays, it is a craze that people, if you take a history of your patients, those who are working in IT sectors or those who are working in shift duties and high profile corporate world, the people are fond of eating raw foods. That are mainly the salads and the sprouts, and the individuals are fond of eating yogurt. Okay, so you need to be very careful. You need to be very firm that you should have a detailing of case taking when we are considering about the cases. Okay, so Kadali Phala is also again Abhishandi and Sotrodhakara kind of thing, and in Anupdesh if you are eating it. So here we will see the variation with Aragvad. Aragvad is one of my favorite drug. It is one of the best drug which you can use in n number of presentation. It is the combination which you make with Yukti that Aragvad will help you in all the cases. Okay, so at Prankal Bhuta was given, it was Panchagavya was given in this case. Then Rakta Prasadak and Rakta Shodhak given, Snehik Nasya was given. So next slide please. So this is the reference of Charak Chikitsa 26th chapter. Okay, Trimarmiya Adhyay. So next slide please. So I will show you, this is the presentation. So it took around 3 months and 3.5 months for complete. No Rakta Mokshan was done. In general cases, when I see the Inrupta cases, but the presentation of this case was such that I didn't feel that the Rakta Mokshan is to be given or is to be used. There was no Jalokacharan was done. Without Jalokacharan, 3.5 months, this presentation was achieved. Okay, next slide, sir, please. Again, this is a Kushta case. I will just wind up in 5 minutes. So again, this is a 32-year by profession. She is a teacher. Again, irregular. So when we are considering about Rakta and when we are considering about Twak related disease, it has to be very careful that the interrelationship of the dosha dhatus, as we know, dosha dushya samurchana janito vyadhi, we need to be very specific in highlighting and understanding the involvement of dhatus, which dhatus. Although acharyas have given the list of dushyas, we need to understand to what extent the dhatus are vitiated. So here in this case, she was taking again the modern medicine. It was diagnosed as psoriasis. So basically, when I consider a case of Kushta in my clinic, I don't name it as Eka Kushta or Kapala Kushta, or I don't name it. I just write it Rakta Dushti, or I just write it a Kushta, and I just it. So when the patient was seen, she was having this Sarvaga Pradeshi Pitika, then there was Kachit Daha, Kandu, Usta. The presentation was so bad. And if you see the history, Aharaj Hetu, the history of Aharaj Hetu, again, the Dadhi was there. Dry fruits, now the people are crazy for dry fruits. People in every desh, they eat almonds, walnuts in excess. So we need to be very careful that the dushti of which dushas and which doshas will be because of this kind of aharaj and vyad. Divaswap, as a teacher, akal bhojan is most common in most of the teaching faculties. Not in our colleges basically, because we have a standard 1 to 2 or 12:30 to 1:30 break. But in those who are teaching in schools or higher secondaries, they are mostly tend to have akala bhojan. Then most of the cases you will find this diva swap as the positive factor. Again, Deepak Bachchan was there. Again, Mahavidyalaya Bhuta was started for and posted for Virechal, and you can see the results. Sir, please next slide. So again, this is a reference, a classical reference. Okay, so next slide, sir. So this is the slide. This is, I have just highlighted it on the hand, that is Kurupara, but the rest presentation was also very bad, and it was healed. But it took around, so it is a Kushta is a Chira Karyavadi. So you can't expect a miraculous result in 8 days time or 10 days time. So they took around 4 months to recover from the complete presentation. So now if you see at the patient, look at the patient, you will not see a single mark of skin representation on that particular skin. So here I think this is the last slide. So thank you very much. These are my books which I have published. Thank you very much, organizers. So these 2 books are Ayurveda Sarvasamanya Sati are for common public, and Unveiled Vad Dosh and Exploring the Mysteries of Pitta Dosh. These 2 books again with special reference to Charak Samhita. So I have tried to make when we are considering about Vat dosh, unveiled Vat dosh, here I have tried to compile. This is a compilatory work. This is not a miraculous work which I have done, but this is a compilatory work which I have done from specifically from 3 or 4 sanas I have included in this book. Part 2 has yet to come. Okay, where I have collected references where Vata term is used, all the references you can see and find in this book. We are considering exploring the mysteries of Pitta dosh, whenever you will find Pitta dosh in the Charak Samhita, you will find those references in my books. And these 2 last books are for the public, that is Ayurveda Samhita, they are in Marathi. The upper 2 books are written in English. Okay, so I am very much thankful to Vishwa Ayurveda Parishad for giving me an opportunity to speak a few my experiences and to help our practitioners, budding practitioners. And I am very much thankful to all the respected members here. And I am thankful to the students, UG students, PG students, PhD students. I am very thankful to the organizers for giving me the opportunity. And thank you very much again. Kati sir.
Sindhura.
Hello everyone again. So the session is open for question and answerings. If you have any queries, please raise your hand in the chat option, and you'll be unmuted.
The participants can unmute themselves and ask. That option is also available.
I think I have taken already 15 minutes extra.
Not an issue, sir. Not an issue. It was very nice that you brought in practical experiences and made it really useful for students, because they get inspired when they see what really happens on ground. Because teaching theory is different aspect, and bringing everything into practice is a different task. And you have greatly done it. I congratulate you for that. And if there are any questions by any participants, we'll take the questions. Yes, there is one hand raised. Dr. Sandeep Desai. Sir, you can unmute and ask. Dr. Sandeep Desai. Okay, any other questions? Okay.
Vikruta Jalapana means what exactly
Sir, basically, when we are considering about Jalapan, it has to be along with food. In Goa, basically, when I started practicing, since then I'm noting that the people have a tendency to sip water at different timings, and they doesn't drink water along with food. Either they will have water, it is in bulk, that half liter of water before food and 1 hour before food, or just 45 minutes before food, 15 minutes before food, or it can be just after having food. They will not sip it along with food. They will sip the water after completing their food. Just immediately after completing food, they will sip around 2 glasses, 3 glasses of water. And it can be again after 1 hour, 1.5 hours, they will sip a bulk. So that's why I have mentioned this as a Vikrut Jalpan. So the word which is used maybe have some kind of queries, but Vikrut means it is not along with food. The pattern of drinking water, it should be along with food as per our text. Everybody knows that. So it is not followed by the public in Goa. That is the that's why the word Vikrut Jalpan was given.
Thank you. Yes, sir.
Thank you, sir. Thank you, sir.
Sir, one question from my side, may I ask?
Yes, sir. Yes, sir.
Sir, in one of the patient, you use Kapila Ragvad as a part of Virachan.
Yes, sir.
Considering, sir, which view, as a Sransan or Bhedan or Anuloman? Can you, sir, elaborate in short, sir?
Yes, sir. Yes, sir. Basically, when we are considering Aragvad, when you read the qualities of Aragvad, it acts as a in most of the Kushta cases, in most of the, as I told, Aragvad is one of the drug which can be used in any form. It can be used as a, it is a Mrudu Anuloman Dravya, it can be a Rakta Prasana, it can be Tvacha Dravya. You should use it in combination. If, as I have used it with Nishottar, sometimes I have used it with Kampilak. Kampilak again is a kind of Rechandravya. So it is a kind of Rechan which I have used in the patient. So as it is Anuloman kind of Dravya which you are using in combination. As I told you, you are free to use a Rechan Dravya or Anuloman Dravya, being understanding the parameters, being understanding the positive factors, being understanding the all the parameters related with the presentation of the case. So you can use any combination for Anuloman. Here in Goa, basically, we tend to use Triphala Nishottar combination. I use mostly Amlaki Nishottar combination. I use Kapila Aragvat combination. I use Aragvat Nishottar combination. So it is a kind of Rechan Anuloman which was expected in that particular case.
Okay, sir.
Thank you, sir.
Thank you, sir. One more thing. I really thank you for Anand Katti, sir, for organizing such a good event. Thank you, sir.
Thank you, sir. Thank you, sir.
Okay, I think we should go ahead.
Okay. So, as we come to the end of this enlightening session, it is my proud privilege to firstly thank you, Samir sir. It was a really enlightening session, especially for the junior upcoming doctors who have not much idea about all the samhitas and all. Thank you so much. So, I'd like to propose a vote of thanks. First and foremost, I again express my heartfelt gratitude to our esteemed guest speaker, Dr. Samir Manohar Joshi sir, for sharing such valuable insights on the scientific validation of Charak Samhita in today's era. Thank you, sir. I extend my sincere thanks to Vishwa Ayurveda Parishad and for the conveners, coordinators, and organizing committee members for their dedicated efforts in making today's session a success. I also thank all the participants for your enthusiastic presence and active engagement, which made today's session meaningful and vibrant. Thank you, everyone. Now, I would like to request Kirtana again to end the program with a Shanti mantra. Over to you, Kirtana.
ॐ सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामया सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ॐ शान्ति शान्ति शान्ति. Thank you.